I am super excited, to be honest. And it's my first time being part of the Women Deliver. So it's really amazing and exciting to be part of all this amazing event. I have been a member of the Global Fund Advocates Network, which is a group of advocates across the world, which is there to really share the impact of the Global Fund. And this year, we are really advocating more on making sure that we have a fully funded Global Fund, and we are building momentum in making sure that donor countries really have an understanding of why we need to have a fully funded Global Fund. Many people thought that I was gonna die when they knew that I had HIV, but it turned out in a different way. And now I'm confident, I'm bold, I look healthy, and I have been given the opportunity to sit on the tables with high-level leaders. So in 2002, when I was just 12, I lost my mother and my younger brother due to AIDS-related illnesses. And it was one of the most devastating moments for me because I had lost the people that were close to my heart. So in 2004, that's when I started getting really sick, losing weight, and I had to stop school for some months. And when I got to know about it, I cried, I lost all my confidence, and I thought I was going to die just like how my mother and my younger brother both passed away. And I was very fortunate that I managed to get access to tuberculosis treatment through a Global Fund supported clinic in Zimbabwe. And this is why I'm really here today to really speak about the impact of global involvement in making sure that adolescent girls and young women have access to life-saving drugs. So what really drove me to be this advocate that I am today is because at some point I faced a lot of emotional and verbal abuse from some of my paternal relatives, and I tried committing suicide. And at that time, it was really intense for me, and being very young, and I took all of the medication that I had, and I told myself I just want to die because of the stigma related to HIV. So one of the organizations that I was working with, that I had joined as a beneficiary, went with me to the clinic. And after being discharged, that's when I received a lot of psychological support. And that's how I got the courage to say, I want to share my story and the stories of my peers to make the world understand how it's like growing up with HIV and being an orphan. And most importantly, being a young woman or an adolescent girl, how it's complicated, and to have better policies that speaks to issues around adolescents and young people so that these issues could be addressed. So in Zimbabwe, part of my role is to make sure that adolescent girls and young women are empowered and are able to make informed decisions about their own health. Because there's a lot of double stigma, especially when you're young, you're not married, and you're sexually active. There's a lot of stigma associated with it. And this, many of the times, shuns us to go to the clinic for accessing sexual and reproductive health services, because they will say, you're young, you're not married, why are you sexually active? And it's even worse when you're a young woman who's sexually active and you're HIV positive. They will say, you're sexually active and you're HIV positive already. Do you want to spread the HIV disease? So these are some of the issues that we face in terms of at the health facility. I'm really here to share about how it is important and how the Global Fund really saved my life at a time that I had lost my hope about life, and I managed to get access. And really, I hope that the Global Fund will be able to continue to scale up its support to give all young women access to HIV treatment, sexual and reproductive health services, and keeping girls in school so that they can be healthy, confident, and they can be also able to contribute to community, country economy, and become future leaders. And this can only happen if you are given the space and the opportunity to share our potential. And thanks to WAN for creating that opportunity for me to represent other adolescent girls and young women across the world. If it was not for the Global Fund and AfricaAid, I wouldn't have been able to be here today, where now I can be able to give back to my community back in Zimbabwe in the same way that I was supported, as the HIV treatment and the ongoing psychological support complemented each other for me to be this bold and healthy young woman that I am today. So in sub-Saharan Africa, 75% of new HIV infections are among adolescent girls and young women aged between 15 to 24. And worldwide, HIV is the leading cause of death for women and girls. So now I'm asking really donors to continue to support the Global Fund and invest in HIV and AIDS, TB and malaria programming, as it will help save lives of people like me. And by doing this, we need local and global voices to come together to make a difference. And when we do this, we know that we'll be able to live a happy, fulfilled lives as adolescents and young people. So thank you so much.